And I'm Dr. Jim Marsh. I'm Chair of Internal Medicine at the University of Arkansas for Medical Sciences and a clinical cardiologist, a clinical trialist, and also a basic science investigator. This afternoon I spoke about training pathways for physician scientists in the United States. And we looked at data from a number of sources, including the National Institutes of Health and university training programs. There are three major pathways for training physician scientists in the United States. This is in the setting of really decreasing resources for research funding and for training of physician scientists. The overall NIH budget in real dollars over the past 11 years has decreased 22%. So this is an intensely competitive and demanding area in which to work. We first looked at the success of MD, PhD training programs across the United States. 111 out of the 131 U.S. medical schools have an MD, PhD program. And if one measures success by the portion who complete a PhD degree, generally they're quite successful. Overall, about 73% of those who matriculate in the MD, PhD program receive a PhD, and virtually all receive an MD. We then looked at the success of so-called research residencies or fast-track residencies. Typically, a trainee would enter a medical residency and do 2 years of clinical training and then go off into a research laboratory or research clinical group for 3 years and then return and do a fellowship in the clinical discipline, certainly including cardiovascular disease. And that has also worked out relatively well, with about 3/4 of people who follow that pathway winding up with a full-time academic career, about another 10% in pharmaceuticals and biotech industry. The key to that, it turns out, is that about 70% of people who enter the residency pathway have previously had serious scientific training. Either have done a PhD, which is most of them, or some have done a master's in science. So that pathway is fairly effective as well. The other pathway that we examined and were able to obtain some recent data from the NIH regarding is the success of the so-called K award training pathways. These are mentored physician scientist training programs for people typically at the assistant professor level who then pursue 5 years of training. The success rate on those has been a little bit more disappointing. For the K08 awardees, about 40% ultimately can get an individual research grant. For the K23 awardees in clinical science, only about 20% get independent research support. So these pathways have varying degrees of success. One thing that is clear is that starting early in scientific training is essential. The data are strong, that if one really starts off in scientific training over the age of 24, one is not likely to be successful. There are probably other measures of success we should include, including the impact of your scientific publications. So this is a challenging environment in which to work, but careful preparation can help one along the way. One of the great strengths of the Congress is the range of experience of the people who attend and present, from junior trainees through junior faculty through senior investigators from around the world. And having an environment where one can informally exchange information is very fruitful.